Although antimicrobial resistance is growing to alarming levels, Kenyans have not risen to the fact that it is an issue that can affect them as it affects all people. But what exactly is antimicrobial resistance? According to scientists, antimicrobial resistance (AMR) occurs when bacteria, viruses, fungi, and parasites change over time and no longer respond to medicines, making infections harder to treat and increasing the risk of disease spread, severe illness, and death. Data published in 2021 under the National Antimicrobial Stewardship Guidelines for Healthcare Settings in Kenya by the Ministry of Health, the country reflects a high prevalence of antibiotics use of 45 to 69%. The study further reveals that there is irrational antibiotic prescription across wards, especially with regard to third-generation cephalosporins and extended-spectrum penicillin, that there is limited or no use of culture and sensitivity tests to guide therapy, and that pediatric and surgical wards have been flagged as areas of focus. AMR is currently one of the biggest threats to global public health. Annual deaths from drug-resistant infections are projected to increase from the current 700,000 to 10 million globally by 2050 if nothing is done. According to researchers, it is estimated that bacterial antimicrobial resistance caused 1.2 million deaths in 2019. Other studies indicate that it is estimated that by 2030, the number of deaths related to antimicrobial resistance and infections will be more than the number of deaths related to cancer, diabetes, and diarrheal infections combined. Every year between 18th to 24th November, there is a World Antimicrobial Awareness Week, a global campaign to create awareness and understanding on the issue. For this year, the theme of the awareness was Preventing Antimicrobial Resistance Together. Despite the cause for alarm, majority of Kenyans still self-prescribe drugs, especially antibiotics, whenever they feel unwell. The primary cause of AMR globally is antibiotic overuse and misuse, be it from doctors inappropriately prescribing antibiotics to treat viral infections or individuals seeking over-the-counter antibiotics for self-treatment. But over-the-counter medication is not the only way drugs are abused, as explained by Dr. Moses Masika, an infectious disease expert.
Drug resistance can mainly or simply be caused by misuse of antibiotics and other medications that treat this kind of germs. And by misuse, I mean we are overusing them. For example, when we do not need them. So when we misuse antibiotics, for example, when you have a cold and you buy antibiotics, colds are caused by a virus. Antibiotics are treating a bacteria. So really you are not doing anything other than fueling drug resistance. Now, besides this example where we have conditions which we do not need to treat with antibiotics, but we insist on taking antibiotics, there is also the story of either taking for too short, or for example, you had a condition for which you are given antibiotics, you use them for 2 days, you feel better, you keep them. And then next time your family member or your friend is sick, you tell them, oh, I had this problem, I got this antibiotic, you can use it. That is really wrong.
In 2017, Kenya developed the National Policy and Action Plan, NAP, on prevention and containment of antimicrobial resistance. The aim of the policy was to improve awareness and understanding of AMR through effective communication, education and training, strengthening the knowledge and evidence base through surveillance and research, reduce the incidence of infection through effective sanitation, optimize the use of antimicrobial medicines in human and animal health, and develop an economic case for sustainable investment that takes into account the needs of the country and investment in new medicines, diagnostics, tools, vaccines, and other interventions. It is important to note that while antimicrobial resistance remains a huge global public health crisis, here in the country, data on AMR is hard to come by. After days of reaching out to health stakeholders, it became apparent the inadequacy of data and statistics on the same. This situation an indicator that the country is still a long way until it can control this health crisis. Dr. Masika is calling on Kenyans and all healthcare stakeholders to be more concerned on the increasing trend of drug resistance resistance.
I wouldn't say they're not hearing, because I think over the last several years, we've had a lot of messaging around antimicrobial resistance or drug resistance. And thanks to the media like you and other people, that message has been repeated. At least in November, we usually have a week focusing on this messaging. So I think it's not that they've not heard. I think maybe we are not listening, or we do not think we are at risk, which is really a fallacy, because antimicrobial or drug resistance can really affect anyone, whether you have money, whether you don't, so long as the drug resistant bug or germs are available or near you and they infect you, they can cause problems in anyone.
As mentioned above, part of the interventions are access to clean water and sanitation as a measure to curb AMR. However, its access to many Kenyans remains a huge challenge, with the ongoing drought further affecting access to water in arid and semi-arid counties. It is feared that the situation has further been exacerbated.
Every time you skip a dose, it doesn't mean you have nothing in your system. You have something, but it's not enough to kill the bacteria. So the bacteria becomes tough, and it eventually develops resistance. So there are different approaches, I would say, from the community. We stop getting drugs over the counter. We practice hygienic or practices in handling food, like hand washing, making sure the environment we are cooking at is clean, making sure that our sanitation environmental sanitation is good, because some of the waste we throw into our environment includes antibiotic products, which keep exposing us to bacteria that is already resistant. And you know what is in the environment will eventually get into the water, it will eventually get into us.
There are several consequences of antimicrobial resistance, including getting sicker for longer, increased cost of treatment, death from ordinary infections, among others.
Drug resistance could have some symptoms, like for example, you have a chest infection that is not going away despite treatment. But this is where the doctors come in, and they will test whatever illness you have, and they can tell from the lab test that the bacteria causing your infection is resistant. It's very hard to look at somebody and say you have drug-resistant bacteria. It could be anyone really, but until we test it in the lab and we can say this is bacteria by the name A, and it has resistance to these drugs. And then that guides the doctor on what to use or how to treat you. But it can happen even in this country that whatever is infecting you, or whatever bacteria has infected you, has developed resistance to all available medications. And at that point, however much money you have, you cannot really be saved, because there's nothing to treat you.
The COVID-19 pandemic brought with it some negative and positive effects in regards to the issue of drug resistance. For one, there was growth in over-the-counter medication. On the other hand, due to increased sanitation, there was a reduction of certain infections like diarrhea.
The bad side was that, yes, many of us were using over-the-counter medications that were not helping the COVID-19 or helping other bacteria. We saw some people using several antibiotics, which isn't really correct. But on the other hand, we saw increased hygiene, a lot of hand washing, and in fact, in some ways, we saw a reduction in illnesses that are transmitted either through dirty hands or foodborne diseases, and also other respiratory infections. So I think it was a double-edged sword.
Due to the dangers of self-medication and over-the-counter prescriptions, the Pharmacy and Poisons Board has time and again been calling on licensed pharmaceutical practitioners to uphold the highest ethical practices in order to ensure sanity in the pharmaceutical sector. The board has as well been cautioning members of the public against engaging in illegal pharmaceutical practices, a trend that seems not to be ending anytime soon. There is a growing concern for antimicrobial resistance in the country. For now, Kenyans are being advised to stay away from self-prescribing antibiotics and to ensure they are more keen the next time they stop taking their prescribed antibiotics, and to maintain high levels of sanitation. This is because one is only one small mistake away from being drug resistant. Reporting for Hope TV News Watch, my name is Grace Wangui.